and welcome to yet another episode of Expressions. I'm your host Neha, and today we have a very special guest with us. We have with us Dr. Suresh Franklin, physiotherapist par excellence, who's worked with several sports personalities, athletes, including mixed martial arts champions. He's also an entrepreneur whose wellness mission now reaches a large number of people through his business of handling pain management and sports injuries. Welcome, Doctor. What is physical therapy?
Physical therapies are something, as a word itself implies, with physical, how you get it inside the therapy. So this was very popular after the World Wars, where the people get injured, and after the injury, the doctor's role is over, followed by it has been handled to the physiotherapist to rehabilitate them completely to the normal life. Today also physiotherapists are involved into 8 verticals. It's not only neuro, it's all about musculoskeletal it is there, and obstetric and gynecology is there, pediatric is there, and it's moving on. Right from last 10 years to now, it's boomed like anything. So that is how the physiotherapy is all about. And now it is a very unique medicine without medicine where you can work on pain management and getting the sports person back into it. And that's how the physiotherapy started booming now.
So tell us, where does your knowledge all come from? Your qualifications, skills. Can we know a little more about it?
Okay, so I did my bachelor in Mohammed Satak College of Physiotherapy and my master's in Mohammed Satak, and did my certification course in the University of South Australia in sports physiotherapy of level 1. And I get trained with Dr. KP, Dr. Kannan Pugarendi from Spark Institute, where I was working there for 6 years. The basic of knowledge towards musculoskeletal was from there. But if you ask me, the sports physiotherapist has, and I was there in sports for right from almost like more than 3 decades. So something the sports was always there inside, so which we want to do it in the country. That dream took me to be the physiotherapist for the Indian team and mixed martial art, where I was there 2 years consecutively for the senior and the junior team for 2022 and 2023 as of now. And there are various ways where you get. So I'll give you a very simple way. I have learned physiotherapy from a mechanic. Okay, in such a way that he says, sir, if your fork in the bike is gone, if you ride the bike for 1 hour and you will see that your right shoulder hurts, your left fork is gone, your left shoulder hurts, your right fork is gone. Okay. When you put your anatomy, biomechanics and normal functional activity, you will find that he is right. And now any marketing executive comes repeatedly driving and riding and he says right shoulder is hurting. We take a step, go and ride his bike and see whether what the mechanic was telling is right. Okay. For every bit of people around you, we learn physiotherapy, not only from books. The moment when you start thinking physiotherapy beyond books, the world is open for you.
So why did you become a physiotherapist?
If you ask me, frankly, physiotherapy was very accidental. Okay, in such a way that one of my school friend already joined one college, so I did not join any college. So I just called her to ask her, where did you join? And she said, I have joined in a physiotherapy college. I just asked her in a very casual way, check whether you have a seat. She's called and she told me that, okay, she has a seat there, and that's how it ended in physiotherapy. But if you ask me, the complete U-turn in physiotherapy and getting endorsed into it, which happened in second year, where I was a break in means in medicine, it is all about you fail. Okay, in 5 mark, you get failed in one particular subject called as biomechanics. And if you are putting it in a very natural way, that was a base for me to be here. And sometimes your fallback is always a setback, and that's how we bounce back in order to get it there. And once you go into it and you already decided you're going to be inside, so we thought, okay, let's deep down to understand what it's all about, and it is taking us into a big dreams.
Nice. And how long have you worked in this field, Doctor?
Putting together almost 16 years in this field, right from the scratch, and over here 2 years, putting it in a very natural way. Again, when we worked, the monthly salary was around 3,500 rupees. And today, if I'm going to hire a fresher and he's asking for 25,000 rupees, and that's how it is boomed. Yeah. And the last 1.5 decades after the recession from 2018, the field has boomed. So we were very fortunate in such a way. As the field was growing, we were also able to grow with them.
Why do you think there was this boom?
The awareness towards the people has become more.
Okay.
Okay, and the physical therapy and their verticals has become more. And one of the area, if you ask me, in sports physiotherapy, now you can see the pro kabaddi, pro sports, TNPL, IPL, and everything is boomed in such a way. Yeah. The sports industry is also started expanding. So injuries also started expanding. They were looking for experts for the athletes to get back to the sport. All these have made a huge difference why this is boom.
Okay.
It's not only in sports but in all the verticals.
Yeah.
Earlier, very few we can expect C-section. Now, very few you can expect normal delivery. Okay, so if it's going to be in such a way, what is that physiotherapist can do in order to get that normal proportion of getting back to your same lifestyle? This plays a very important role. Now, if you see in corporates and ergonomics, it's one of the very important field. We don't tell them how you sit, how you stand, and how you, which is not possible practically. If I tell you to sit like this for all the way for 8 hours, not possible. But how do you prepare yourself to do what you want to do? And that has been advised.
Okay.
So prepare yourself so that you can do whatever you want to do. Eventually, you don't end up in injuries. And if at all you are ending in injuries, how to find the initial flick of getting an injury and rectify there, and you will not get into any big problem. So that's how this field has been booming up. It's all about.
So, and what does your typical day look like?
Busy day. Okay, if you ask me, 15 years back, I start my day at 4 o'clock in the morning, training a group of marathon runners, and it ends up with 11:30 after my complete house visits. Till date, I don't know how my son grew from his birth to his 7 years. I don't know how he is grown. And today, if you ask my daughter, I am seeing her every step. Okay, that's how I was very busy making my career. So thanks to my wife, so we're taking care of the family completely in such a way. But it is boomed in such a way that we were able to scale up. As and when we were scaling up, we were able to make a difference in many people's life. So we started with one-man show, and today we are a team of around 23 people working in Synergy, and that is how it's all about. And we've been growing.
And you're there only in Chennai or in other places as well?
As of now, we are there in Chennai. We are in 2 branches, Ananagar and Besanagar. Yeah. And very shortly, in less than 4 months' time, we'll be there in Bangalore and Coimbatore.
That's wonderful. Also, can you describe your approach to therapy?
Okay, our approach to therapy is very different from the conservative physiotherapists. See, because the conservative physiotherapists, what people have a myth in their mind is physiotherapists are somebody who works only with machines. No, these trends are completely changing. So, 2013, when I was starting my clinic, my mentor asked me 3 questions. Number 1, already in Ananagar, you have 6 clinic. Why 7th one clinic? And the second question he asked me, what is that 6 people who are not doing and you want to do? And the third question was, why people have to come to you? So this is the 3 question where you have to answer if you want to start a clinic. And that is how it's all started with. And here we ensure that, okay, I went, to be very frank, all the 6 clinic I went as a physiotherapist without having a pain. As a patient without having a pain. And I've understood in such a way, all these people are working only with machines. One area which was not tapped because it is more time consuming is manual techniques. So I invested my time, energy, putting together to improve the skill of manual techniques. That time we were considered so crazy because people were telling us, without machine, how can you work? You will not be able to survive not even 9 months. If you ask me, fast forward 10 years, now we are a pathfinders. So there are a lot of college students in the final year and internship. They are coming to Synergy to learn this technique, how to relieve a pain without using machines. So for us, platform, flight, airport, anywhere, what I need is only a flow. I can fix anything in terms of pain. So that is how it's all about. That's how we've been very different from the other physiotherapists.
And what are the advantages and disadvantages of the approach you take? Like you said, manual and machines. So what are the advantages and disadvantages?
Okay, so advantages are anywhere and everywhere you can treat people. Okay, the disadvantages are making people understand what you're trying to do. And also, it's a very unique approach. You have to make people explain what you're trying to do, in what way it works. Because the industry is boomed in such a way that it is more of machines and conservative. Taking that complete 360-degree turnover for the people to understand that that's not so. Now there's a new trend which is coming up, and that's giving an immense result, and that is taking little time for us to make people understand and believe that, oh, this is how it works. And once you get there, and eventually, now people who come to Synergy, they know that these people work like this, and that's the reason they come, and they get all right. And eventually they refer people, and that is how we've been growing. Till date, if you ask me, we never invested anything for marketing. It's completely about word of mouth, and that's how it works.
Yes, and it's doing very well. But doctor, when you said manual and machine, so don't you feel that machine is more quicker way to relieve pain?
In such a way, yes, okay, that is how it has been portrayed in
Yeah.
terms of machine is quicker way to relief. And but if you know the technical way of doing your diagnosis properly, manual is very effective.
Okay.
See, at the end of the day, what you have to tell people is what you're not supposed to do and what you're supposed to do. As simple as that. Okay, think about that. At the time of any flood, there is no power. Do you think the clinic runs with machines? Not at all. But for me, it's not the case. At the candle, I'll run the clinic. Okay, and just to understand that it's the completely manual tech. That is how we worked in COVID. I used to get my tiffin box at 5 o'clock in the morning and go back home at only at around 12:30. And because no hospitals were welcoming people, and just because of getting in the home, people were injured massively because of the posture. Okay, seeing TV, Netflix for so many hours, eating, crunching, and everything.
Yes.
And that was completely a big disaster towards musculoskeletal problem. We were so busy in order to work. So if I have to tell them, I need machine, I have to carry this, I cannot come. No, it's not a way. What I have to carry is only my hands, which is always with me. So
Yeah.
that is how we work. And if you ask me, COVID time was a boom time for synergy, where God has helped us in such a way that we can touch many people. That's how it all went well.
Also, you're a sports physiotherapist and you've worked with the billiards, badminton, and cricket league teams. Can you share some experiences?
From 2010 to 2010 World Championship to Syria, I worked with Indian billiards. So I worked with one particular individual which I traveled with, Mr. S.E. Salim. Now he has a Salim Snooker Academy in Chennai. And he's the one who's given me that opening in order to get there. And eventually after that, we underwent with a lot of county teams. And very recently, we worked with TNBSL, Tamil Nadu Badminton Super League. And for Marina Dolphins, we were the physiotherapists and they were the champions. And for TNPL, Karekudi Kale, when the Chettinad group was there, we were as the second panel of physiotherapists who was designing their exercise and injury management. And as I said, 22 and 23, so we were with the Indian team for the Indian MMA, mixed martial art. So both the senior and junior team, we traveled to Abu Dhabi. And that's the first time India was winning a bronze medal from Vidhi Kumari. So she's a Senegal and she won bronze medal there. So that was the first medal when I was there with the team. So our role is very big, getting the athlete back to the sport immediately after an injury.
So, any example or any experience that you can share where you treated an injury and the athlete was able to get back? Anything that you can share with us?
Okay,
Any
so
incident?
I remember one of the Indian squash player. Now he's India's number 2, Hariyant. Okay, and he's only 19 years old boy. And there's another guy called as Abhay Singh. He's also from the squash and under 22 years old. So there was an injury what he was suffering from his ankle, and he went for scan and everything, because these problems will not be seen in any investigations, but only through experience you have to find that problem. So we sorted the problem before his Asian Games, and he won gold for the Asia. Okay, and for India, he won the gold for the Asian Games. That's one of the biggest achievement which I can remember quickly when you ask me.
And how did you sort it, doctor?
Oh, it's all about with the manual technique again,
Okay.
and telling the athletes how long it's going to take and
Yeah.
what it is all about. See, when it comes to sports physiotherapy, they have only 3 roles. First role is preventing the injury.
Yeah.
And the second is early interventions at the time of injury. And third one, returning the athlete back to the sport. Okay, this is the 3 role. If you ask me, 80% of our role is only on the first area of preventing injuries.
Okay.
We tell them what you have to strengthen so that it doesn't happen. So in what way you have to get educated and what you have to do in a regular basis so that it doesn't happen again. All these has to be addressed to the athletes now and then. Sometimes the excitement goes, they go very heavily, and that is the reason why we always have a sports psychologist with the team as well.
Okay.
So to maintain them, to alter them, to get them calm, you cannot be aggressive even though you lose 5 points. All these are something which has to be behind the scene. So that is how it works.
And with or without medication, when you work with them, would you recommend physiotherapy sessions with medications or without?
Okay, so a team will have a doctor, the team will have a nutritionist, the team will also have a trainer and physiotherapist. So it is well defined that this is what your area is. So when it
Okay.
comes to medicine, the doctors will take care.
Okay.
When it comes to the food part and the other supplements, the nutritionists will take care.
Yes.
So here, when you prevention of injury and after the injury getting back to the sports are the main area for the physiotherapist.
Okay.
And you have to maintain their history of medicals and followed by the performance enhancement. So that's a complete role of physiotherapist in the team.
And doctor, you've also been conducting a lot of workshops. So would you like to share something what these workshops are about?
Okay, so I want to be a teacher earlier. So, okay, and very slowly that has become a passion now. Okay, and till date we have touched close to around 18,000 students in physiotherapy, right from third year to the final year, and PG students as well. We take two areas of workshops. One is called as trigger point release technique. The technique what we use it for pain management. Another thing is right from the basic of structure, core, fitness, and antenatal and postnatal. So these are the exercise regime. We take it as a workshop to understand people because we believe right from the scratch, if he's getting educated, and we don't tell them what you have to think, but we always educate them in such a way how you have to think. Okay, so why is that this problem is always seen only in one view? Why not in 360 degrees? And that is exactly we get them into the second year and third year itself, so that he has another 2 years of time to think, get back, explore many areas, and come back with something new. And that's the reason why we started getting workshops. Now my passion is getting equal to my profession and eventually getting busy. And now we started moving across the country to teach people because the vision is very simple. In a year, we have to touch 3,000 students. Okay. That's how exactly it's all about.
I'm curious, what is this trigger point that you mentioned? If you can share a little more about.
Nothing big deal, ma'am. So it's earlier. It's all about like muscle knots. Okay, so தமிழ்ல சொல்லணும் அப்படின்னா முன்னாடியெல்லாம் ஊரில் இல்லை கிராமத்துலலாம் வந்து எங்கேயாச்சும் சுருக்கு பிடிச்சிச்சு அப்படின்னா எண்ணெய் ஊற்றி அதை உருவி விடுவாங்க. ஸோ அதே டெக்னிக் தான், பட் கீப்பிங் த சயின்ஸ் பிஹைண்ட். Okay, so people used to do with olaka, people used to do with sombu, so people used to do with jordal, people used to do with yellow. ஸோ இப்போ அதை வந்து என்னன்னா மெடிசனாக ஆக்கி அதுக்கு ஒரு பெரிய சயின்ஸ் பின்னாடி கொடுத்துட்டு அதே டெக்னிக்கை தான் யூஸ் பண்ணுறாங்க, பட் இன் அ டிஃப்ரெண்ட் என்விரான்மெண்ட். ஸோ பட் த கான்செப்ட் இஸ் ஜஸ்ட் த சேம், பட் த எஃபெக்ட் இஸ் மேசிவ்.
Yes, I'm sure. How do you go about devising a treatment plan for your patient?
Okay, depending upon many factors.
Yes.
One is the age, okay, of the patient, and one is the chronicity, whether it is only for 3 days or she has been suffering for 3 years.
Okay.
Okay, and that's how the treatment plan will completely vary.
Okay.
So when it comes to pain, we follow 4 protocols. One is when it comes to pain, you release the muscle, you stretch the muscle, and then strengthen the muscle. So there are a lot of ways where people release, get the pain off. They stretch, they teach them stretches, but strengthening area has not been done. Yeah. That's where we feel there's a very lag in this profession, because physiotherapists are very good in treating people, but still they have to get more equipped in learning about designing a rehabilitation. Yeah. So if you know how to design a rehabilitation, too good for them, because the only way how you can design or become expertise in designing a rehabilitation is very simple. You have to do it. Okay, you cannot only say, and you have to do it. The moment when you do it, you feel it, and then you know how what has to be given and what not has to be given. Okay, and that's how simply it's all about.
What are the risks, limitations for physiotherapy, and are there any pros and cons?
See, pros and cons is, if you ask me, the only thing which we have to get better is collaboration. Okay, see, there are a lot of doctors who are looking for a very comfortable and knowledgeable physiotherapist and competent physiotherapist. Okay, that's what it's all about. People always say, okay, orthopedician and physiotherapist doesn't match, doesn't work. No, it's not like that. There are a lot of doctors whom I work with. Okay, they're very comfortable with me. And if they're going to go for one step ahead, and they always ask us, like, can we get this one and start doing that? Okay, that's also opinion. It's all about how people believe you, how the doctors believe you, and what is your skill set. And if they know, they trust you, and they send their family members for you to do treatment. Their parents come, their wife come, their children come. Okay, usually it is a very hard scenario that doctors prescribe their medicine in their own family itself. But it's very rare that they send to another physiotherapist to understand, okay, sir, he's suffering with this one, can you help him? No, that's very rare. Only when you get that point of where you are able to build that trust, eventually people will be very comfortable in giving you what you want to do.
And how do you stay informed about the new technology and new treatment methods? How do you stay?
So now it is getting very highlight. So because if you see about posture, okay, so earlier it was in such a way that you have to take a posture, you have to line a scale, you have to keep a chart, and you do a lot of paperwork. Now AI is completely taken over. Yeah. Put him somebody, okay, click a picture, and it will tell you where you're right and where you're wrong.
Really?
Okay, it is in such a way that it is boomed.
Okay.
Now there are a lot of softwares which can tell you, okay, so a lot of leads and software, there are a lot of bells which will tell you if you're going to go slouch, and it's going to give you a vibration for you to make it straight. Self-awareness. So like this, a lot of technologies is involved. But again, coming back, rather than getting more onto the technology as a help for you, it's always good. But at the end, prepare your body in such a way, do whatever you want to do.
Yeah.
So that preparation in terms of exercise, in terms of some activity which will always will help you to do what you want to do. So forgetting about the first part and you want to get only the second part, and very slowly the physiotherapist also will become a patient.
And what is the role of a physiotherapist in a multidisciplinary setup?
You need a team.
Yeah.
Okay, so when you're going to planning to do something which is you're going to scale up, okay, you need a complete team to handle it completely. Okay, so here we are a team of around 18 people. Not all the 18 will do the same work, and everybody is in charge of something else. So somebody who's in charge for designing a rehabilitation, somebody is in charge for treating people, somebody is in charge for workshop, somebody is in charge for other programs which we support as a sporting team. So when we are doing multiple things, and that's what the organization is going to grow. But if everybody does one single job, it's like too many cooks will spoil this food.
Yeah.
So you don't enter into their forte, they don't enter into your forte, and it's very clear defined. KRA to what you have to do and what you're not supposed to do.
Sure.
So that I can see in the last 10 years we have some nowhere where we have grown, and we also know the game plan of what we're going to do for the next 10 years.
Yes.
So I have a dream of a Benz and a penthouse. Don't worry about it.
And what can one expect from a physiotherapy session from you? As in, how long does any common injury take?
So one thing very specialty about Synergy is the patient care. Okay, so any emergency, we are there with you. Okay, and how this problem has to be handled, and what is the first step. Just because I got a patient, I should not say, okay, this is what, and you have to do this. No, there are a lot of times I have asked people that you don't have anything, you go home, do only this, and you will be fine.
Yeah.
Okay, after putting a complete case, doing all the assessment and all. So let's not show the desperation of you want a patient and you want to do something about it. No, not necessary. Okay, but if you know ethically, okay, this is what helps them, then do it. Or else unnecessary X-ray, unnecessary MRIs, unnecessary scans, investigations, nowhere required. I don't remember in the last 16 years, at least 4 MRIs I would have prescribed. That's it.
Really?
Okay, and people don't come to me from all these scans to give a recommendation for me because they know that this fellow will not do it. Okay, only when it is required, it is done, or else it's not required.
Yes. And that kind of relieves a lot of stress for people also. So what makes you happy doing this physiotherapy? What gives you joy?
So one statement which comes to mind after this thing is touching lives, okay, and giving hope and confidence. It's not only for the patients, but also for the therapist who's working with me. Okay, so when they come out, they come raw. Okay, after working with me for 2-3 years, they have the confidence of I can start something very individually, I can run about it.
Yeah.
I love that confidence.
Yeah.
So till date, there are 9 physiotherapists who worked with me, went out, they started their clinic in different places. And there are few people who are working in UK in NHS, okay, National Health Science.
Yes.
And that gives me so much of happiness. I am able to touch many people's life. When it comes to patient, if you see the other side, they are very scared. So they have asked me to go for a surgery for this simple reason. And that's how the question starts with. After understanding that this doesn't require any surgeries and all, it's only a simple way. If you do this, this will be fine. And they feel very relief. And we always get the statement saying, just talking with you itself, the pain is gone.
Yes.
Okay, so that is a statement what we very regularly hear from the people. And that gives us a lot of boost, motivational for us to do what we want to do for a bigger scale.
Yeah. You mentioned NHS just now. What is the difference with the NHS program there in the UK and in India? Is there anything that you think we should implement?
Oh, technology.
Okay.
So technology is something where they have been using, okay, in terms of patient coming in for the software, what they use it for, assessment, what the software they use it. And here, India, it's going to take at least another 1.5 decades to get into that area of technology. Okay, where they are depending more on technological path. And also they are looking for manual experts at any point of time. So the people who have worked with me are specialized in that. So they worked in a clinic and they did one exam and they cleared that exam and eventually they got placed. Yeah. So the specialty about rest of the other physiotherapists here is now you're ready to do manually and anywhere and everywhere. Yeah. So that's the biggest USP for somebody to sell himself to be something very specialization the rest of the other crowd. That's very important.
And doctor, do you think that only those who have got injuries should do stretches, mobility and your sessions, or just everyone should do?
If you don't want to get into injury or if you don't want to get into any problem, you have to do.
Yeah.
See, people have this idea, or when the doctor says, go for a walk, and they always think, I'm doing exercise. No, walking is an activity, it is not an exercise. See, because it's like painting, singing, swimming, dancing, walking.
Yeah.
Okay, and it's an activity. People think, okay, I'm doing 1 hour of walking, I'm doing exercise. No, you're not doing exercise. Exercise are basically goal specific. When you target this muscle, this area for this goal and this mobility and this joint, and that is how this exercise is all about. Okay, so exercise and walking are not the same, they are totally different. So you have to do exercise, not only walking. You can keep the walking as a warm up, but apart from that, you have to do something called as exercise.
Yeah. And I also know that you insist a lot on stretching, and especially calf muscle stretch. Why?
Okay, the calf is called as the second heart of the body, and that's the reason, because you have one heart which pumps your oxygenated blood all over, and the calf muscle is another secondary heart of the body where it has to pump the fluid from down to up. Okay, there are people who complain saying that hanging your legs is swelling. That's because the calf is not working properly. It has to work like a pump like this, but when it gets tighter, it works only like this. Okay, it's in that way. I don't remember that history, but I remember the story of that history. I'll tell you in a very short way. There was a king where he used to, anybody who had been caught like after doing a theft, he used to call that person and he just only cut the calf muscle and leave him. He can go do treatment and whatever it is. Just because of his limbing, people will understand that he is a thief.
And he's punished.
And in a later way, in a span of around 8 to 10 months, after getting 6 to 7 diseases, he will die by his own. So now you know the importance of calf muscle.
Yes.
Okay, when the stagnance of fluid there, and eventually it will gill you into different areas. And one muscle which always we have to be very keen is all about with the calf muscle. So that's one of the anti-gravity muscle.
Thank you, doctor. And what condition have you successfully treated till date?
You name it, we have done it.
Really?
Okay, in terms of musculoskeletal. See, there are a lot of people, they come with verticos. Okay, taking Vertin 16 or Vertin 8 for so long. And there are a lot of people who have been taking sinusitis medicine for almost like 6 years, 7 years. Just one muscle in the neck, which can be misdiagnosed as that of a vertigo and sinusitis. If you're going to work that one, you can feel a big differences there towards that people. And sometimes, yes, injuries in terms of different sports injuries and different musculoskeletal injuries, where there is a choice is only surgery and not necessary. And people have this myth, okay, only for diabetes you will get a frozen shoulder. Frozen shoulder, okay, if you don't do this and that will happen, and all those areas. If you don't treat the frozen shoulder without anything, either a medicine or in terms of physiotherapy or anything and stuff, in 2 years time it will get all right by its own.
Really?
And that's how it's all about. Okay, so 3 stages and 3 paces, and it gets all right by its own in 3 years, 2 years itself. So you don't have to have any big intervention, but educate the people in such a way, this is what it's going to go and this is what it's going to take. And we have to be very careful that we don't give any false promise to the patient.
Yes.
That, okay, if you know that it's going to take 3 months, but you can give it's very easy to give a false promise, like in 10 days I will make you fixed and all that. No, it will never happen.
Yeah.
So if you don't give any false promise, and again, that's also one step for you to grow faster.
And what is your greatest strength?
My wife. I'll tell you why. Because at one point of time, I was need of a help in my organization, because the organization was growing. Till today, if you ask her, she will tell my husband's dream is my dream. In 2017, she left her HR job in BNP Paribas in the French bank, and she joined in Synergy. After she came in, we have grown. Okay, because she's brought a lot of system and process in place, which I was not able to do it. Okay, so the background for what she is, and from the system and process, today, Franklin is not required in 2 clinics, and it will run on its own. And that's the reason I'm going everywhere. Every week I'm traveling to teach. I'm started following my passion, because the system and process are in place. So she's one of biggest strength. And if you ask another one step up, the purpose is my kids. As simple as that. Okay, because the kind of a childhood what I had, the kind of a childhood what they are having, that was my dream. Okay, so I was able to give this difference. So she's one of my biggest strengths.
Wonderful to know. And how do you cope with stress? And do you think stress has an impact on our muscles?
Correct. See, the stress, putting in a very layman term, if you're trying to control uncontrollables, it's called as stress. Okay, so and the stress, yes, and it gets direct impact on your neck and shoulder. And that's the reason more of the people are more prone to spondylitis and frozen shoulder or any, there was another condition called as trapezitis. All these are conditions are in such a way that just happens because of the shoulder. Directly it involves the neck and shoulder muscles where they get stiffer followed by the headache.
Okay.
Okay, and obviously when you get a headache, you know what happens.
Yeah.
And that's how it's all about. So stress has a big impact. Another way of stress is any small problem also, it will blow big. Okay, because of the secretions of hormones in the body, which is not good for the health. Because that injury, it will make it bigger.
Okay.
So that's the reason why we say, okay, your anxiety has to come down for you to get recovery faster. So don't be curious about, okay, 3 days is over, 5 days is over, 10 days is over. Give a time. Okay, in such a way. So if you know that healing has to take time, healing will take time.
Yeah.
The doctors decide their treatment according to the body's response. It's not about what he studied.
Yeah.
So if I'm going to give you a paracetamol of around 250 mg and your fever is fine, it's fine. Okay, in 250 mg, if it's not fine, next day when you're going to come back, I'm going to give you 650. That's how the doctors work.
Yeah.
That's the same way it goes with physiotherapist. The day when I work, next day you're coming back and telling me that 40% you're better, my protocol of the treatment will change.
Okay.
Okay, so if still my 40% of the pain is not achieved, still I have to hold on with that protocol. I have to make people comfortable with 40% and then proceed.
Yes.
And that's how it's all the feedback of the people. And we always stay humble, saying this is always a word within the team and everybody. We treat, we don't have a control for healing.
Yeah.
Okay.
But how do you cope with stress? I mean, what would you say if when people come to you and you know that they are down because of stress and anxiety? So, is there any way?
See, if it is extreme stages, we might require the expert's advice. Okay, psychologist, psychiatrist. Okay, in that way, and talking with people in a funny way itself, it makes them to let them cool down, and making them understand. Okay, this is what your problem is, and now tell me how you're going to handle it. And we put a question and get an answer from them to understand. You have controllables and you have non-controllables. What you can control is your thoughts, your emotions, so that your body gets better.
Yeah.
If you're going to control the non-controllables and it's going to get whacked, okay, now it's your choice.
Yes.
So in that way, we advise them and we also tell them, okay, meet these people, so they will be able to advise you and henceforth and all those stuff.
So you become a counselor also at times.
Eventually, you have to be.
Yeah.
See, because there are a lot of times where people come for you only to talk.
Yeah.
Okay, especially people after 60. I don't know whether you have heard this one statement in Tamil. They call it as Kairasiyana doctor. Okay, the word Kairasiyana doctor means if you touch, it will be fine.
Okay.
Okay, so there are a lot of people whom we, sir, I'll call you, you take the call, we'll talk, I'll be fine. Okay, there are also, but if you ask me whether that is a myth, no, it works phenomenal, but in the psychological aspect. Sit, talk with people itself, you will find this word called Kairasiyana doctor, and especially people after 60, they need somebody to talk. Okay, you just talk with them, listen them completely, and then answer yourself. They will say, "Summer doctor." The moment you interrupt what they are trying to tell, and he will go back and tell you, he's not listening what I told also. Okay, and it's like, so if you're very good, they will tell only to 10 people. If you're bad, target is 100. Okay, so that is how it works.
I've watched myself that you and even your team are able to identify any problem just by watching the person. How is that?
Okay, that's also again one more skill of observation. Okay, so when you walk, okay, and that's the experience and the expertise. When you walk, you should understand whether the problem is in the ankle, knee, or hip, or in the back. It's very easy. By holding the arm in which direction and which position, we can tell that the shoulder has dislocated. Okay, and he's got fracture. Okay, and all this comes only with experience and expertise. Right, left, center. If you start observing people, we know how it works. And if you, I'll give you one example. If you would have gone for any passport size photo to take a photo, you will understand yourself that the person who's taking a photo will say, come on, lift your head, turn to one side, tilt it to one side. You will have a feel that, okay, I'm looking straight only, no, that is how the feel it's all about. But according to you, you are straight. According to him, you are in one side.
Yes.
Okay, how you correct that one? All these are matters a lot in terms of observation. So when people talk with us, coming with a right neck pain, and he says he's already here, it is understood that the problem is already set, and which he is not aware of. So we educate him what you're not supposed to do and what you're supposed to do in order to get out of this, and how to correct this one. That also plays a big role.
Yes. And how do you motivate your patients?
motivate your patients? Different ways of it. One is like telling them putting it in even though you know that this is a problem, and you have to talk in such a way that very simple form you have to talk to them. இதெல்லாம் ஒரு பிரச்சனையா, இதெல்லாம் சப்ப மேட்டர் சார், இதெல்லாம் 5 நாள்ல சரியாயிடும் சார். You have to beg what they thought. You have to talk it like very. So this is something which we see. You are only 0.2% that 100% what we see. And when you're walking out, you walk out with a big smile and big hope, saying that okay, this fellow will fix us.
And it works like magic.
It works with magic.
And in most cases, how long does your patient take? How long do they recover? Like how long do they take to recover?
Okay, as I said before, it's all about depending upon the age, the gender, the chronicity of the problem.
Yeah.
Okay, if a simple problem, it's anything between 5 to 12 days.
Okay.
Okay, if it is something which is a little bit bigger, at least it will go for 4 to 6 weeks.
Okay.
And that is how the problem has been rectified. It's all about. But when it comes to other factors, the problem of the patient's pain will settle down in 5 days. But we insist them to do exercise with us for the next 2 weeks. There they will escape.
So
Okay,
why
so what
would you
happens
insist on this 2 weeks?
Because this 2 weeks of stent training will avoid the recurrence. Because the main cause of this problem is because of lack of strength only.
Yeah.
But people always feel after the pain is gone, I'm done.
Yeah.
Okay, and if you see this scenario, after 6 months, 8 months, they will have a recurrence. To avoid that recurrence only, we are telling them you have to do these exercises so that it doesn't comes back.
Yeah.
Okay, but yes, as I said, people are very good in getting out of pain, but they don't follow the protocol. And I was giving a convocation. There was one medical doctor who told me, okay, so trust human 100%. Yeah, they will not do what you told them to do it. Okay, and keep your dukan open, they will come. That's how it's all about.
Yes. And can you give us an example of a successful outcome, in your therapy session, and how you've helped someone overcome their chronic problem?
I would not say a chronic problem, but a fatal accident. Okay, so in such a way, I remember a biker, okay, who was only 12 years old. Okay, and he is a motorsport athlete. So he's a racer. Okay, and he broke his arm. Okay, kept a plate, and we call some condition as wrist drop. Okay, on his left hand. So left hand is always used for the clutch when you drive a motorcycle. Okay, on the racing part. And we educated the child in such a way. This is what is going to happen. This is what. I remember seeing one of his video. Even though his right hand was not in his control, he used to go every day and he used to wipe his bike. Okay, and getting ready. Helmet he will prepare. He will prepare his jackets every day, saying that one day I'll get inside the bike. And that will motivate us and him, because his positive thinking is very much important for him to get back. And today is India's #1 of motor racing. And every year when he is here, now he is in Spain. So every year when he comes here, he comes visits us and says us thanks. And that's how it's all. If you see, okay, this is a big achievement. Yes, this is the big achievement what we are. From no hope to hope and champion. That is how where we stand with.
Lovely. Doctor, tell us about a time when you handled resistance or non-compliance from a patient. How did you handle it?
It's very, critical question. Okay, in terms of resistance, people don't want to do it, but still you insist them to do it.
Yeah.
Okay, and in our country, we don't have that controls. See, in abroad, it's all about with the insurance.
Yeah.
Okay, people come in and they stay for 1 month, 2 months because it's covered by the insurance. So because here the medical system is such a way that you have to take it from your pocket and give it, because physiotherapy is not covered in medical insurance. Okay, till date.
Okay.
Okay, and especially inside the hospital it is covered, but once it comes to the private sector and practice, still it is not much covered in the physiotherapy field. So every time if I'm going to take it something, my pocket is, I'm not comfortable. Okay, that is how the resistance
Mentality
happens.
is.
Even though we know this is going to take such a long time for you to get out of this problem, people understand, but they don't want to do it. Okay, because why? Okay, that is a question where it stands. Making them to educate, understand, it's very easy. See, even though you're going to tell them 500 rupees, they're going to bargain. That's how it's all about.
Okay.
And they don't see what kind of a service and what kind of a quality they're going to get. People who know us for more than 6-7 years, they don't talk anything much about it.
Yes.
Because why? They know, okay, here if you go, you get 2 things. One, I will know what is my problem, or I'll get all right. Only 2 things for sure. So
Yes.
that is the people, how they walk in.
And what do you feel is the most important muscle or part of the body required for mobility?
Everything. Okay, when it comes to every part of the muscle, it's
Like
very
you mentioned about calf muscles. So is
exactly.
there something else like which is the most important that one should take care of?
Okay, calf again.
Okay.
Okay, that's the only muscle which you have to take care of everything, because
Okay.
once it goes above the knee joint, okay, you have a lot of controllables. But when it comes to the calf muscle again is a lot of indication for big problems. They indicate us the moment the pain is increased. Okay, the calf muscle bigger in size and the skin started shining. Okay, that is one of the biggest symptoms for, we call it as DVT, deep vein thrombosis. In deep vein thrombosis, your exercise and there are a lot of other protocols of manual techniques are contraindicated. So your calf gives you that indication. So with the calf muscle tightness, you get swelling. So in that swelling, if you put a finger and if you press, you will see a pitting. If the pitting is there, it's called as good swelling. If the pitting is not there, then I have to check about the internal organs. Like this, the variations of lower body will give you a lot of indications about how your body system works. Calf again is a very important muscle. But if you ask me, every muscle is important. Why? Because if one muscle gets pulled, also the whole body suffers.
Yeah, that's true. And you know, I believe that exercise helps a person prolong their lifespan. What is it you feel that a person should do every day to stay healthy and fit?
Okay, so I remember one of my client. Okay, she's 72 years old. Her name is Nirmala. You know what is my lifetime goal is to at least to take one time the weights what she's doing.
Yeah.
Okay, so she will put all the plates in the cable and she will do a lat exercise. We call it as incline rowing. Okay, and instead of that, she will not be satisfied. You'll ask the grandson to stand on the top of it and she will do it. For me, getting into the 6 plate itself, I have to say 6 and she will go 15. So that's a goal. So it doesn't matter with the age here, ma'am. It's all about with the mental strength. Okay, and yes, it will reduce your aging.
Yes.
And you make fit. See, even though you are completely bald,
Yeah.
and if you're fit, people respect you. Okay, so and either the parents of or this generation, there's only two ways for the next generation. Either you are a warning or an example.
Yeah.
Okay, so no, my grandfather had this problem, this surgery, and he was creeping,
Yeah.
and he was in the wheelchair for so many years, and went to the deathbed, and he died, and is a warning. My grandfather is like a big role model for me. The way in 90s he was taking care of himself and doing everything, and he was riding and driving,
Wow.
and he is an example. So now you have to decide whether you want to be an example or a warning for your next generation.
Yes.
So
But how is it working? Like, would you say that weights are important for older generation, old people? Because there's a myth that, you know, most old people don't take up to weights.
okay, so that's one half hour scale in such a way. So if you ask after 60, there is no gym welcoming people. Okay, and there is a myth saying that gym is only for the youngsters and for the middle age group. And why there is no gym for people above 60? Even though at that point of time they have money, they have time, only less energy. To improve that energy only they want to do exercise. Okay, but this industry is completely turned off in such a way that okay, after 60 no gym, and people also are very scared about that area.
Yeah.
No, after 60 either you are going to be a billionaire or you're going to be a pauper. Only one goal, I want to be independent. Okay, for that what you need is you have to take care of your body.
Yeah.
Okay, irrespective of anything.
Yeah.
If you are able to do lot of activity with your own body, then you can pick weights. If you're not able to do a plank for 1.5 minutes, picking your weights is no way use.
Okay.
And if you're not able to do something in a free hand exercises in your shoulder press and picking a 5 kg dumbbell and doing it, no way use. Because in free hand itself you're not able to do it, but in weights you will not be able to. But we can progress. Right from scratch, slowly you have to start and you can progressively you can go ahead. And that's where physiotherapists and fitness trainers play a very big role in designing exercise.
So, doctor, would you say that after 60, your muscles get weak, and that's why it's important to also take up to weight training?
Exactly, ma'am. And also after 60, if you're trying to do something, it'll take a long time for you to get that tone.
Yes.
But if you're going to start that one
Consistent.
from the consistently right from your 20s, 30s, 40s, at least
Yeah.
weekly twice, weekly thrice, we call it as a conditional training.
Yeah.
If you can do that and have a regime, that will be very healthy and good. So that you don't have to push so much at the age of 60 in order to maintain them.
Yes.
Rather, natural way of being that built itself will definitely will be there.
And how are young generation taking up to fitness in your experience?
Fantasy.
Yes.
It's all about with the fantasy. So if you see this this season, okay, from March to July, you will see a lot of youngsters will hitting the gym because after 12th going to college,
Okay.
and there is an industry there. Okay, and from 1 year to another year. So I finished my college and I'm going to go for a job and now I'll hit the gym. Okay, after you get married and everything is gone. So it's like this. That's how I say it's a fantasy. So getting a muscle there, getting a fitness there. No. See, if you come into the word of fitness, according to me, fitness is nothing but a self-defense. Okay, a dog chases, you have to run. Okay, if you need, you have to climb the wall and jump the other side. This is exactly fitness. Okay, if you know, okay, I have to do this, I have to do this burpees, and I have to do this crawl, I have to do 20 push-ups, not required. Okay, and that is not it's all about. It's basically self-defense. If I know something happens on the floor and I have to, can I hold the tree and climb down? That is called as fitness.
Okay.
Fitness is all about self-defense.
And would like to know what do you know about varicose veins and how do you treat?
Okay, so varicose veins are a bulged veins which is from the lower body. Okay, and there are many reasons for them. People who sit for long, you get varicose vein, and people who stand for long gets varicose vein. As I said, when the calf muscle doesn't pumps in such a way, the first feature what they get is a varicose vein. But if you ask me, a typical way of getting a treatment for varicose vein, not well defined. Okay, there are valvular replacement done by vascular surgeons, but the respected valves gets involved and injured. So if you see a varicose vein, you will see a lot of worms, and there are also manual techniques which is contraindicated for varicose veins.
Okay.
Okay, and there is no defined treatment for them. For if you want to prevent them, keep your calf healthy. Either stretch, strengthen, or you can 15 days or 20 days you can go for a massage. Okay. So in that way, it will help you to keep your calf in healthy. The more you keep your calf healthy, you can avoid varicose vein. Just because you have a red web, red because you have a green web, blue web, it doesn't mean you have a varicose vein. Now, it has to be in a very chronicity stages where it has to have a lot of bulge like a snake and a worm it will be. And that is called as the stage 3 varicose veins.
Okay.
Other than that, normally the web and everything, that you can work. That is not a problem.
Okay, thank you. And what supplements should one take? What do you feel, what would you recommend?
Okay, there is no specific supplement. See, supplements is a word which is used for when you don't get naturally, how you substitute them.
Yeah.
That's how it's all about. When, if you ask me for a North Indian and the Jain, okay, and they don't take any non-veggies, okay, how are you going to supplement the protein? At that time, you can take a protein supplement, like say any branch of protein eggs or whatsoever it is all about, where you can use it for the supplements. And sometimes sprouts, sometimes beans, and all these are areas where it will compensate. See, supplements are not arm if you know how to use them. Okay, it's like handling a knife. Okay, so for instance, right from the childhood, you are given right for the baby Cerelac, non. Okay, and you have had so much of coffee, tea, and you are eating Boost, Complan, Horlicks. All these are supplements only, which you don't get it naturally, and you are using as a supplement. That's how it's all about. The moment we get into whey protein, people always have a myth, oh, I will have that supplement, kidney will go, liver will go. No, if you know how to handle them, and it is always safe, and it gives immense result. And that's how it's all about. In sports, supplements are used.
Would you say that one should take vitamin D or anything in particular that is necessary for everyday life?
Multivitamins are always necessary for everyday's life. It is irrespective of ages. Okay, if you're going to be about 30 or very close to the menopause, you can add calcium. Okay, but if you ask me, as a physiotherapist, I'm telling these statements very subtle way. Okay, a physician will be able to give you a better picture on what's it all about. Where you have to go for series of tests to understand where you are deficient, and from there how you can supplement it.
Okay.
As simple as that. Vitamin D, yes, the supplements. The natural way of a source is only sunlight.
Yeah.
But how long you will sit in the sunlight, and when you will sit in the sunlight is a big question. And that's how it's all about. So how you supplement them, there is a medicine to supplement them. So they are the people to advise them on it.
Okay. And can you correct a hunchback with
can.
your... So
Okay, see, we have two things, okay, hunchback and stooped posture.
Yeah.
So all these are small variations here. Okay, so until or unless the bone is not getting a structural changes, we can correct them muscularly. So most of the time it's rounded shoulder which is causing the hunchback. So first open the chest and followed by exercises on the upper back will eventually work. And these generation, you can see stooped posture and hunchbacks are very, very common.
Yes, because
The
of
way they
its.
sit
Yes.
matters here a lot. From now, after half a decade or 1 decade, if you want to see a bride and bridegroom, they're going to ask you whether you're straight. That's it. They're not going to ask you how much you're going to put. Okay, and because seeing people straight is the biggest challenges these days rather than anything else.
Those shoulder straps, would you think that would be helpful to correct a hunchback?
Okay, if somebody is into a profession of sitting for 8 hours and working, you want to have self-awareness, you can use a strap. And there are a lot of vibrators which comes with the strap as well. But now for the youngsters, I would not recommend straps because that's very temporary. They'll go beyond them. And eventually the best way for the younger generation, like say from 10 years to 18 years, if you want to correct the hunchback, the best exercise is swimming.
Okay.
And especially breaststroke.
Okay.
Okay, because it has to be horizontal and his arm movement towards pushing the water will strengthen the upper back like anything. Natural way of correcting. And yes, if you want to go a little faster, better, you need to meet a therapist or physiotherapist in order to get designed an exercise. Swimming and exercises parallelly will make massive difference.
Okay. Thank you. And what are the two signs of Achilles tendonitis?
Okay, one is pointed pain.
Okay.
Another one is walking on the toes is very painful. Okay, these are the two signs.
Okay.
And
what is the cure?
there are 5 protocols which we use it for cure. In Achilles tendonitis, one, you release the calf muscle. Okay, we could do a treatment in terms of trigger points. Next, you can do something called as taping. And third, there is one machine which if you want, you can use it called as ultrasound.
Okay.
And 4, we talk with the physician and find a NSAID, non-steroidal anti-inflammatory drug, and frequency of stretches. If you're going to follow these 5 protocols, Achilles tendon can be brought down. The definition of this problem is nothing but one tendon is getting inflamed because of repeated overuse. And if it happens only in one leg and if it is not happening in another leg, it can be because of the posture.
Okay. So it won't heal on its own, you're saying?
Any wound, it will heal on its own, but it will take long time. Till then, if you're going to walk on the toes or compensate that walk, secondary problems will happen in the back and the knee. To avoid them, recovering things are faster. Achilles tendon is a very common statement.
Okay. And what causes knee pain? And what should you not do when you have a knee pain?
Okay, so knee pains has many reasons. See, one of the very important reason when equally you get knee pain on both the knees, it's all about with the body weight.
Okay.
Okay, and if one leg it happens, other leg it doesn't happen, and there is no incident of injury, neither at a fall or a bumped in anything, somebody thrashed you or anything. If you don't have any incident of injury, and that is more related to the lifestyle. Putting it in a very nutshell way, if you're going to sit every day 2 hours cross leg sitting, one leg on the other, and if you sit over a period of 3 years time, you will get a knee pain.
Okay.
And that's how the posture is all about. And just because the joint space is narrowed down in an X-ray, it doesn't mean there is a knee problem.
Okay.
Okay, if the muscle gets tighter also, you will have a joint space narrow down. If a muscle gets weaker also, you will get a joint space narrow down. You have to understand, assess in such a way, and then you have to find. But as a layman to the public, how you can find a knee problem? Lie down, bend the knee. If you are able to bend and open the knee properly, there's no knee problem.
Okay. So what is the fastest way we can treat arthritis? What are the do's and don'ts?
Okay, there are 2 types of arthritis. So one is we call it as rheumatic arthritis, and another one we call it as osteoarthritis. Rheumatic arthritis, yes, you don't have any big controls. It can be more of genetic, and there is a changes which has happened in the blood, and it will start eating the small soft tissues within the joints. That's how the rheumatic arthritis is. You can maintain them, and there are few medicines which says that you can cure them. But what in my point of view is you can maintain them, and if you can do exercise on routine basis, you can maintain them for a longer period of time. There are few alternative medicines they say they can cure them. We don't have any idea about it, but it's something a changes which has to happen in the blood, because rheumatic arthritis is something which is confirmed by the blood test of RA factor and anti-CCP, that the value will say that you have a rheumatic arthritis.
Okay.
Osteoarthritis are something, putting it in a very simple way, wears and tears.
Okay.
Body weight, you've been whacking them right, left and center. That the wear and tear which happens within the joint surface is called as osteoarthritis. Sometimes people get fractured and they crosses the joint line, and then later the wear and tear, and that will lead into osteoarthritis.
Which is worse?
Rheumatic is worse, okay, because it will creep the complete smaller joints and it affects the smaller joints followed by the bigger joints. When it doesn't, when people say it's a rheumatic arthritis and it is not affecting the smaller joint, then you have to start thinking about it. It can be elsewhere, or anything else, but not necessarily it has to be rheumatic, because in rheumatic it always first the smaller joints followed by the bigger joints. So hand and the foot are somebody who gets into different angles and deformities, and that's how this problem is all about.
Okay. And how can you tell if it's a fracture, dislocation, or a ligament tear?
Okay, so fractures are as the continue of the bone is incontinued,
Yes.
okay, or it is broken. The swelling and the pain will tell you whether it's a fracture. Dislocation, the basic normal joint movements, you will not be able to do it.
Okay.
Okay, if somebody is dislocated and holding an arm here and coming to the clinic, if you're asking him to lift, nowhere possible, and the pain. But in dislocation, the moment you relocate, the pain will become zero.
Okay.
Okay, and the fracture part, even though you do any protocol of things, and you will know that okay, this is something is not in position. Now X-ray is required for you to confirm. The moment a doctor or a physiotherapist gets a doubt of saying that okay, it might be, we don't keep it in mind. We go for X-ray.
Okay.
Because that's the early intervention what you can give it to the patient, for him as well as for you. Okay, you should not keep thinking saying that it might be a fracture and start treating elsewhere.
Yeah.
Rather confirm the investigations, understanding that okay, it is there, it is not there, then follow through with the treatment, and eventually you will find. Ligament injuries, yes, all these three problems will be having an incident of injury.
Okay.
When people say, I did not feel any, I don't remember any incident of injury, but I had a small knee pain, I went for MRI and they showed me ACL is completely torn. No, it cannot happen. Okay, the ACL can be tear, or the ligament injuries in the body can be only when there is an incident of injury. People say degenerative changes can also tear, and I ask a question, why only one knee, why not the other knee? Why only knee? Why not the other part of the body? That is also, there is a big question and the myth over there. So, but fracture, dislocation and ligament injury, you definitely have to have an incident of injury.
Okay. And is osteoporosis a very serious condition? And can it
Yes.
be treated with physiotherapy?
Yeah, so osteoporosis, yes, it's a serious condition. We call it as brittling of bones. By exercise doing, you can reduce osteoporosis, or you can avoid osteoporosis. Once you have confirmed with the bone density test that you have an osteoporosis, yes, you have to go for one IV, which will happen every 6 months once for treatment, or you have to go for a calcium medication for you on a regular basis in order to maintain the bone calcium level. What kind of a symptom people will say? Head to toe, they will have a pain.
Okay.
They will say completely there is a pain. And sometimes the pain keeps shifting. Monday here, Tuesday here, Wednesday will go to the knee.
Okay.
We call this one as a floating pain. And this can also be either an osteoporosis, or it can be either vitamin D and B12 deficiency also.
Okay.
So that's how it's all about with osteoporosis. But after 20 years of your menopause for women, osteoporosis are very common. That's the reason after 50 they start giving you calcium tablets.
Yes.
Like say Shelcal or example, irrespective of any calcium tablets of 500 mgs or whatever, they take it very regularly. So when
Okay.
prescription comes to us, the patients ask us, sir, can we take this? If you read that prescription, we will know that doctor is trying to pump him with a lot of calcium
Okay.
for him not to get into the severe part of osteoporosis. Because we remember seeing patient with osteoporosis just banging in the table and bone 2 pieces.
Oh.
That bad the osteoporosis can be.
So you've had a lot of patients who've come to you with osteoporosis, and have you been able to treat them
In terms of musculoskeletal way,
Okay.
parallelly they'll go for medications,
Medications, yeah.
and in terms of musculoskeletal way, we make that bone to get little firm, or a support to a bone by strengthening the structures.
Okay.
If you start strengthening the muscle, the bone gets a little bit of firm and support, so that will avoid big impacts.
And what is the treatment for muscle loss?
See, muscle loss has different variations. See, sometimes if you have any medical conditions as like say diabetes, also you will have a muscle loss. If you're talking about only my size of a muscle or a hypertrophy of a muscle is not getting built up, it's all have to be built with a strengthening process. And there are a lot of medical conditions like say, if you say hypothyroid, okay, the muscle loss will be there. In aging process, the muscle loss will be there. In diabetes, the muscle loss will be there. So you should know the background of a medical, why this muscle loss is happening. But for all the muscle loss, the only solution is to strengthen them.
Okay.
Depending upon the age, depending upon their problem, depending upon the chronicity of the problem, I have to give, how we have to give that protocol of exercise has to be little varying. As simple as that. See, here, the people who are there, like say, both the shoe size are not the same. Okay, and we see here, always the exercise are just the same. Okay, so a 16 years old who get injured also will have do the same exercise. 63 years old male also will do the same exercise. 40 also will do the same. No, it is not like that.
Yeah.
Your exercise has to be designed. You can see in a lot of medical centers, you will have a printout of paper. People tick and give you what you have to do.
Okay.
That is not how the exercise should be.
Yes.
It should be variably and customized according to the people.
Yes.
And that's how it has to be.
And how important is breathing while exercising? Tell us the difference between when you breathe in exercise and when you don't breathe in exercise.
Okay, so when you breathe properly and when you do exercise, you can do the exercise for longer.
Okay.
Okay, and if you don't breathe properly and when you do exercises, you will get exhausted very faster. Okay, and that's how a lot of, like say, assuming that I'm going to give you a plank and I'm telling you, okay, hold the plank for 1.5 minutes. Okay, and if you're properly inhaling and exhaling, you can hold for 1.5 minutes. If you're holding your breath, you cannot go more than 30 to 40 seconds. You will drop down. Okay, that is how exactly it's all about. So when you have an effort to push, you have to exhale. When you relax, you have to inhale. But muscle to muscle, the position of how you do the exercise also varies with it. That's the reason where you need an expert's advice there.
Okay.
But when you breathe properly and when you do it, you can do the exercise a little longer.
Okay. Thank you. And what do you think of alternate therapies like hydrotherapy, aquatic, and you have acupuncture, and you have electrical nerve stimulation therapy? So what do you think? What do you feel about all these?
Okay, so all these are, as you said, alternative therapies.
Yes.
See, India is very famous for alternative therapies than any country in the world. And that's the reason we say number one medicine-oriented place is only India, especially South India, especially Chennai.
Yes.
Okay, so anywhere and everywhere you get everything in Tamil Nadu. Okay, in terms of alternative medicine. Okay, irrespective of anything, especially South India, you will find that is very famous. People have a choice.
Yeah.
Either I can go for homeopathy, I can go for Ayurvedic, I can go for allopathy, I can go for what do you call Ulichi, and I can go for other Varma. I have a choice of plenty in order to do it. But for what problem you address where, that matters a lot. And
Okay.
irrespective of anything, the therapies or the treatment where you have a trust will work.
Okay.
Okay, when you don't
Faith.
have a trust and the
Yeah.
faith in that particular technique, irrespective of how many years you are experienced, it will never work.
Okay.
So it doesn't mean that the doctor is treating you. No, the doctor is not treating you. The faith of the patient is making the doctor to work there. As simple as that.
Would you recommend any of this strongly besides your
At times.
physiotherapy?
So in sports, we recommend Ayurvedic Ulichi technique. It's a deep tissue massage.
Okay.
For every 20 days, we ask an athlete to go for a massage because of deep knots can be removed.
Yes.
Sometimes people feel that okay, this medicine is very allergic to me when it comes to Ayurvedic. My abdomen irritation is there,
Yeah.
and I'm feeling nauseating. Now check for homeopathy. So like that. So I'm a allopathic person. Okay, in terms of physiotherapy comes under allopathy as a paramedical way. And if I'm going to recommend anything, it's their choice.
Okay.
But I can tell them, okay, if this is not working, think about this one.
Okay.
If this is not working, think about this one.
Okay.
And that's how it goes.
And also notice that with a lot of pain, you also recommend ice pack therapy,
Yes.
hot and cold therapy basically. So what do you have to say for that?
Okay, one of the biggest medicine is your ice. Okay. So people doesn't know the importance of ice. There are two ways where you can avoid icing is your deep cut, you have to avoid icing.
Okay.
And when you have burns, you have to avoid icing. So
Why?
to avoid infections.
Okay.
Okay. Rest of the other injuries, you can you can ice it.
Okay.
You don't know whether there is a fracture, but it is swell. You can ice it. Okay. And there are few places where you cannot give hot, you can give ice. In hot, the challenge is you have to maintain the temperature. In ice, not necessary. 1, 2. When you can give hot and cold.
Yes, exactly.
When you
my
have
question.
a blood clots,
Okay.
you had a fall, okay, and you bumped on the floor and you're having a red patch here, you can give 2 minutes hot and 2 minutes cold. And for especially for the blood clots on the superficial layer, we call this one as contrast bath. Okay, giving hot and cold.
Okay.
Phenomenally works.
Yes.
It will strung down, make a dot, and it will vanish.
Really?
And like it will be like a black magic. Today night you do, tomorrow morning when you get up, you will feel that it's shrunk down. The map has become smaller dot, and then it's vanished.
Wow.
And that's how it's all about in terms of ice and cold. But when it comes to ice also, it matters how you want to do it. Okay, you cannot keep the ice in one place for more than 8 seconds.
Yes.
You have to rub.
Okay.
And you can do it for 3 to 5 minutes. So after 3 to 5 minutes to 30 minutes, same effect only. Why waste time? So 3 to 5 minutes of icing is well enough for you to do what you desirably want to build there. So that is something which is very important. So when and all you can give hot, when and all you can give cold. Any problem to bone and joints, hot.
Okay.
Any problem to the muscle and soft tissue, it's ice.
Okay.
Any problem related to the blood flow, both hot and cold.
Okay. And you think it works much better than medication also?
That works much better than medication. And people get ice very easily.
Yeah.
Okay, so we have one myth saying, whenever you get a foot pain, you have a bucket of lukewarm water, you put Gypsum salt inside and you keep the foot inside and they say, much better. Okay, but still people don't know what is the science behind that Gypsum salt.
Yes.
Okay, either it is curing your problem or taking a pain away, or it is observing the negative energy. People have different school of medicine, have different thoughts.
Yes.
Actually, the science behind is keeping the temperature of the water a little longer. That's it.
Oh, okay.
Okay, so when you put a Gypsum salt, 5 minutes something, the water is going to get colder. Now it will be staying for 15 minutes. That's the goal of having a Gypsum salt. That's the reason why when people transport ice from one place to other, they put a Gypsum salt and they transfer. So it doesn't melt quickly. So sodium has that capacity of maintaining the temperature for a little longer.
Okay.
That's it. And it doesn't goes inside and works. It doesn't pulls any negative energy. Nothing. According to my point of view.
Yes. Thank you. And what advice do you have for the young sports enthusiasts today?
Okay, so little away from the gadgets and more focused and keeping yourself fit. Okay, it's very important for the youngsters. And biggest challenge what we face with the people is all about with the posture. Okay, the posture is something which is very important. What and all you're not supposed to do, you're not supposed to do. Okay, or as I said in the day one, prepare the body in such a way, do what you want to do. One. And very important, youngsters, definitely you have to get into some sport or some activity. Okay, at least for recreation. Playing badminton, playing football, doing an athletic activity, playing basketball. At least a child, every day he has to sweat, warm up and cool down. So that his systems works perfectly better. The more you're going to be keeping it very subtle, and it's going to get rust. It's going to get rust faster.
Yes.
And that's how it's all about.
Last question. Tell us about your achievements, awards, and what are your future plans?
Okay. As a physiotherapist, a lot of things yet to be done. Okay, so in 2011, we have been awarded with the Peak Magazine, okay, as a best physiotherapy clinic. And 2020-21, we've been awarded as a best clinical award by Chettinadu Group from Chettinadu College of Physiotherapy. And I have worked personally with Indian team, and that is one of my biggest achievement and a dream. And if you ask me, the plan for it to go is, yes, touching more lives. So we want to make the team a little bigger, and we have to make more branches so that whatever we are going to do as a services towards the people over here, we want to do it in the rest of the other part of the country, so that we can make a lot of differences of two things: building hope and confidence, building hope to the patient and confidence to the physiotherapy students fraternity. These are the only two visions for what we have, and hoping in the next 5 years to 10 years time, we should be able to take. So the game plan is already ready. So only thing is we have to get down and start working onto it. So
Thank you.
We should be there.
Thank you. We wish you all the best.
Thank you. Thank you so much.
Thank you for your time today. We've learned a lot and a lot of good insights on exercise and fitness that we've learned. Thank you so much.
Thank you so much, and thank you so much for Indulge and Indian Express for welcoming and giving honor and honor to be a part of Indian Express. Thank you so much.
Pleasure is totally ours. Thank you.